The advice and opinions expressed by Dr. Grant Piche and her guests are meant solely as suggestion and should not be in any way construed as child-specific advice.
Dr. Doreen Grand-Piche is Dr. Doreen is an expert in autism. Doreen Grand-Piche.
Dr. Grand-Piche.
Dr. Doreen Grand-Piche.
Dr. Doreen Grand-Piche is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
So the first question, my son is 3 and just started ABA and school. What do we need to do to assure his best possible outcome? Great question. Great way to kick us off.
Exactly. Wonderful start to this discussion. So, I guess I see it as a very, very simple answer, and I'm sure it's not that simple for people when you think about it, but it's actually quite simple. You look at any child at any age and you want to establish some goals first, right? Like, so my child is not doing certain things and I'm concerned. I don't even care what the diagnosis is, Chad. Like, it doesn't really matter to this discussion. It could be autism. It could be anything else that could be, a disorder that affects arithmetic, which actually exists. It could be dyslexia. It could be ADHD. It could be anything that's going on with our child. And we look and see, oh, my child is not doing really well in a certain area, right? And, we talk about autism not only because we work with kids with autism, but also because autism is very pervasive and it influences multiple different areas of functioning. So, for example, with ADHD, language is not really affected. Attention is, right? But with autism, we're looking at more than one area. And we're looking at for different children, it's different things. So it could be their language is affected, their social behavior, and the results of their language is affected. A lot of children have issues with cognitive skills, like perspective taking, theory of mind, executive functioning skills. Some children who are actually very severely affected by autism might even have issues with motor skills, adaptive skills, kind of like self-help, taking care of yourself daily. There's lots of different things that are affected, right? You establish that as a parent, and you're like, okay, these are the areas that I want my child to have special help in. And it doesn't really matter what kind of help, but we're talking, these are the areas I want to help my child to improve. There's lots of reasons why we might want to help our kids to improve. That's a different discussion. But once you've established those things, you have to go back and say, okay, how much time does it take for me to actually get to these goals? And are these goals realistic given what my child is struggling with? So, for example, you might have a child who had a lot of underlying health issues that are going to affect their progress. So you need to make your goals realistic based on whatever else the child is dealing with, right? But you establish those goals and then you work towards them. And from my perspective, when you establish the goals and you are realistic about what can be accomplished in what period of time with whatever intervention, you're going to get to those goals. The issue is, what are the goals you're setting for your child? And we talk about that for a second because that's where it starts to get complicated. So as parents, we tend to maybe, when I remember talking to a lot of parents when I used to do intakes myself frequently, and I would say, so what do you want for your child? Okay, so we have an idea of all these things that are maybe delayed or different. What do you want? And some parents would right off the bat say, I want my child to function like any other child. I want my child to attend first grade, second grade, and I want them to have friends, get married, go to college, all these things, right? Other parents would say, I just want my child to not hit his sibling, or I want my child to not run away, right? So when you have a lot going on, it becomes very difficult to, you kind of we as people tend to select the goals that are the most vital and right in front of us. So, for example, yesterday my child ran away and I almost lost my mind. So my goal is just to get my child to not run away. So, and that's understandable. It's a very normal thing for us to want to think about the most serious thing. But then once we have that under control, you need to select another goal because realistically, our kids continue to learn. They never stop learning. And especially if you're doing ABA, you can increase their learning the more ABA you do. So this question of what is the highest outcome or possibility is really is very closely tied to what the parent chooses for their child and how committed, I guess, everyone is to making that happen. Does that kind of address the issue, Shanna?
Yeah, I mean, I think it definitely starts to Dr. Grandpichet. I think because she's asking the question and because she said my child has started ABA and school.
And school. And it is 3. So we got
That's
that particular scenario.
Yes.
Let's say in the beginning, you do an assessment of your child's skills in all different areas of functioning. So we're talking about language and social behavior, adaptive behavior, motor, play, cognitive skills, executive functioning skills, and of course, academic. All the different areas of functioning, right? And you establish that your child is doing pretty well in all of these areas, except maybe they don't have a really good social skills. Like they have language, but they don't know really how to use that language to interact with their peers. Okay, then it might be beneficial to actually have partial ABA, partial school, because now you're already exposed to other kids, and the ABA therapist and the therapy program can really help your child hone in on those skills and then apply them to that environment in school. That's one child. About another child who is lacking in the area of language, doesn't have all the skills necessary to express themselves or to even understand a lot of what's going on around them, and maybe also have some challenging behaviors. A few, right? Doesn't when they get frustrated because they're not able to express themselves, they might shove or push instead of expressing themselves. Now, if you take that child at the age of 3 and you have, let's say, 15 to 20 hours of ABA, and then the rest of the time the child is in school, what you're doing is you're putting the child in an environment that they're not ready for yet. You're putting them in an environment where possibly they will have other kids bullying them. They're not able to really interact with other kids. It won't be a successful integration often, right? So in those cases, our preference or my preference is to say, why don't we use the age of 3 to 4 and really give your child a ton of one-to-one teaching, which is the ABA, get their skills to a point where they're going to really benefit and then integrate with other kids, because now they have all these additional skills that they learn and now they can use those in a school setting. I want to make sure that when my children go to school, they are successful, right? Because they're going to be in school for a long time. I don't want them to go to school and have a bad experience, and I have to really work on reversing that. So that's the second child. The third child might be someone who is even more severely affected, right? They don't know how to communicate at all. They, as a result, have a lot of different challenging behaviors, et cetera, et cetera. With that child, I'm not only going to try to keep them out of school for a while and really work on one-to-one skills, but it won't even be just for 1 year. I might want to do that for 2 years. I'm going to be working with the child to get them to a point where when they start using their time in school, they're successful. I think parents need to realize that the most valuable thing for our kids when they're starting out is time. It's time. It's when you feel, and I believe me, Shannon, that I have so many parents who say to me, but I want my child to learn social skills. And I think, therefore, if I put them in, I don't know, the gym with other kids or that kind of thing, it'll help them, or school. it'll really help them. And I will tell you, every skill is taught best when it's one-to-one in ABA. Every skill, it doesn't matter what skill it is, every skill is taught best in an ABA one-to-one format. It is not taught as rapidly or as efficiently in school. Why? Because the person in school, the teacher might be the best teacher on earth, but they have 20 kids to deal with, and sometimes more, or 40, or exactly, or 40. And the issue here is you don't get that time back. When your child is 3, you have a couple of years of time where you could be doing very intensive APA work to get the child's ready, right? And that's, I mean, think about it. When you go to another country and you want to learn a language, you definitely take some classes. And the more classes you take and the more practice you do one-on-one, the faster you're going to learn that language. And then you can use it in your day-to-day life. And I think that's something that is very hard because as parents, we feel better when they're in school. We feel like they're starting in school, and we trust schools. That's the other thing. We trust the school to be able to teach our kids. And, you and I have had too many bad experiences, unfortunately, where we feel that schools, and there's a lot of improvement, I will say, but schools are still not really, first of all, teachers don't have the training that a behavior analyst receives. They just don't. And their method of teaching doesn't work as well for kids with autism. They, as I said, have 20, 40 other kids to deal with. It's just not as conducive to growth and reaching the highest potential.
Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.